Did you know that 1.1 million people living in America have HIV? Pretty crazy, huh? Before working with patients who have HIV, I never really understood HIV. And to be honest, I never really took the time to understand it. When I saw someone with HIV, I always thought to myself, they must be gross. I really don't want them near me. How rude and insensitive of me. I guess it's safe to say, at some point in life, we have all been rude and insensitive. But what we fail to realize is these people we are rude and insensitive to are people just like us. And most importantly, they have feelings. What makes me any better? What makes you any better? Nothing. Especially when we're treating somebody with a disease different than how we would treat a normal person. Automatically, we think, wow, they have HIV. They're dying. Well, that is completely false. Truth is, most people living with HIV that are undetectable are healthy. Just like you and I. They're able to live their normal lives. Just like we are. They play sports, go to the gym, cook dinner, have family events, and many more things. They're no different than you or I. Everyone has a story. Some good, bad, some really sad. Working with patients with HIV, you learn that some situations are sad, and they didn't ask for them. Some kids are born with HIV because their mother failed to get treatment while pregnant. Some people got raped, and their attackers were HIV positive and didn't care that he or she was infecting an innocent person. Some people's significant others cheated on them and contracted it with their mistress and gave it to their husbands or wives. Sad, right? Most people think if you have HIV, it's because you get around. Well, as you can see, that's far from the truth. HIV is a virus that attacks cells in the immune system, which is our body's natural defense against any illness. The virus destroys a type of white blood cell in the immune system called the T helper cells that make copies of itself inside the cells. T cells are, or as we call them, CD4 cells. They're also known as T helper cells. As HIV destroys more T cells and makes more copies of itself, it gradually weakens a person's immune system. This means that someone who has HIV and isn't taking any medication will find it harder and harder to fight off infections and diseases and can make them very sick. However, the rate of HIV progresses, the rate of which HIV progresses varies depending on age, general health, and background. HIV can only be contracted by coming in contact with a specific bodily fluid of someone who is HIV positive, like blood, semen, or pre-seminal fluid, or as we know it, pre-cum, rectal fluids, vaginal fluid, and breast milk. It can also be contracted if you use a needle that someone with HIV has used. There is not enough HIV in saliva, sweat, or urine for it to be transmitted through that route. HIV is most infectious in the first few weeks after being infected. During this time, most people are unaware they are even HIV positive. Some people living with HIV that are undetectable, which means the effective treatment has lowered the amount of the virus in their blood levels where it cannot be detected by a normal blood test. If someone has HIV, they shouldn't wait to get treated. It is important to start treatment right away so it can help them get undetectable, and also it can increase their T cells, which can help lower their risk of developing AIDS. Even after someone becomes undetectable, it is important they continue to take their medications daily so their medications can keep fighting the virus. Reaching an undetectable state can help anyone live a healthy life with HIV. In staying undetectable, there is effectively no risk of sexually transmitting HIV, which means that they can be a part of ending this epidemic by preventing the virus from being passed on to others. Pretty cool, huh? HIV doesn't have a look, so we shouldn't judge just because someone we know has HIV. We may never know their story. In conclusion, HIV is a lifelong disease that we must live with. As of right now, there is no cure for HIV. HIV can be very hard for some people to understand, But once you speak to the right people and educate yourself on the disease, things become a little easier to understand. Also, but don't be naive and protect yourself always. Thank you.